This is becoming a pandemic of the unvaccinated. We are seeing outbreaks in parts of the country with low vaccination rates because unvaccinated people are the most at risk, says CDC Director Rochelle Walensky. As October 2021, the Centers of Disease Control show that there has been over 720,000 COVID-related deaths in the United States alone, and only 54% of the population is considered fully vaccinated. That is also showing that 97% of the people who are hospitalized for COVID related illnesses are unvaccinated and the rest are breakthrough cases. That's a major difference showing how vaccines are effective in preventing major illnesses. Today, I'll be elaborating a little bit more about the vaccines readily available to the public. It is important to know the facts about the vaccines. First, I'll be explaining the development behind COVID vaccines. Second, I will be going over some questions people have regarding it. And finally, I will explain how you can get vaccinated and how you can help a loved one get vaccinated. Today, I'll be talking about the most readily available vaccines, which include Pfizer, Moderna, Johnson & Johnson. COVID vaccines are safe and have not been rushed to the public, or they have not been untested. Coronaviruses such as SARS, which is the Severe Acute Respiratory Syndrome, or MERS, the Middle Eastern Respiratory Syndrome, have been around and vaccines have been developed for them. They are part of a coronavirus family. COVID-19 is another coronavirus that's similar to the viruses that I mentioned, and because there have been other outbreaks and there has been vaccine development, scientists were able to use the previous information to understand and develop a new vaccine for the COVID-19 strain. No vaccine is 100% effective. Scientists are still monitoring vaccines to ensure that they will continue to protect us, the population. Once vaccines have been developed, they must be approved by the FDA, or the Food and Drug Administration, and go through a series of trials. 3 trials are usually completed with several volunteers participating. All volunteers are from different backgrounds, and results are recording how people respond to the vaccine. Since we are in a pandemic, trials have been sped up. However, there has been no alarming concerns for a few weeks when they went back for follow-up, so the information was sent over to the FDA for approvals. Due to the pandemic and the need for a vaccine, the FDA issued EUAs, or emergency use authorizations, to administer vaccines to the public. The 3 vaccines approved for EUAs include Pfizer, BioNTech, Moderna, Johnson & Johnson, and Janssen. The FDA has now fully approved the Pfizer vaccine, which is currently set at 2 doses. Due to the continuing research and clinical findings, the FDA is working on authorizing a booster shot to those at high risk and to healthcare workers, or they're trying to get vaccinations for students or kids that are as young as 5 years old. There's still a lot that we're learning about COVID-19, and using vaccines is a very good preventative measure, and our scientists and doctors are working their hardest to find the best solution to help stop this pandemic. There's a few misconceptions about the vaccine. It's important that you get your information from credible sources. These are the most asked questions or common misconceptions about the vaccine. The first one being, I will not get sick because I'm vaccinated. According to the CDC, like I mentioned previously, there is no vaccine that's 100% effective. The vaccine protects you from getting seriously ill or from dying from COVID related complications, and it's able to protect you against new variants. Think about the COVID vaccine as a flu shot. Many people get flu shots every year, but you can still get sick. However, that flu shot does reduce the chances of how much you get sick. A single dose of the vaccination will begin 2 weeks, or the World Health Organization states that 2 weeks after you get a shot, you do not have a lot of protection. A single dose vaccine protection will begin 2 weeks after inoculation. This would be the Johnson & Johnson vaccine because it is a single dose that you receive. And for vaccines with 2 doses, such as Pfizer and Moderna, the most immunity occurs after the second vaccine. The next commonly asked question is, does the COVID vaccine alter DNA or anything else in my body? No. According to the CDC, there is no interaction between the COVID vaccine and your DNA. There is mRNA, which is a component in the vaccine that delivers a spike protein, which is not a live or weakened version of the virus, and it just tells our immune system how we can create the cells to create protection against the virus. It is safe to be vaccinated while you're pregnant, and it is safe to be vaccinated if you're trying to have children. There's also no evidence showing that there's any microchips inside the vaccine so the government can track you. Another commonly asked question is, do I need to wear a face mask if I'm vaccinated? It's currently recommended by the CDC and the HOW, or the WHO, which is the World Health Organization, that a mask should be worn in a crowded indoor area, and you should maintain a distance of at least 3 feet, cover sneezes, coughs, and wash hands frequently. Wearing a mask is not necessary if you're outdoors, but it is encouraged. It is important to follow your local state guidelines or regulation mandates. It is important to note the right facts if you have any questions about the virus or the vaccine. You can find additional information on government-based websites which deliver credible information, such as the FDA, which is the Food and Drug Administration, the CDC, which is the Center of Disease Control, the WHO, the World Health Organization, or you can always get information from your local public healthcare services. After learning about a couple facts about the vaccines, I'm going to explain how easy it is for you to schedule an appointment to get vaccinated. For the most part, if you have not received a vaccination, you can call your provider's office, which is a doctor, or you can call a pharmacy and they'll probably tell you how you can get an appointment scheduled for you to get vaccinated. If you do not have a provider, you can visit myturn.california.gov or myturnca.gov, and you'll find plenty of resources. There's no cost to getting vaccinated, even if you don't have insurance. Everyone over the age of 12 at this time is currently eligible for the vaccine, regardless of immigration status. If you or a loved one does not have transportation, services can be provided to you to make an appointment, or they can do an in-home visit so they can administer the vaccine at home for those who can't leave. Depending on what vaccine you receive, you may need a second dose or another appointment. Both Pfizer and Moderna require 2 vaccines, usually 4 to 6 weeks apart. Johnson & Johnson vaccines are a single dose. The CDC and the FDA are working on booster shots, and Pfizer has been currently approved, so another appointment would be scheduled for that separately down the future. Some people have experienced a couple side effects with getting their vaccinations, and it is to be expected because the vaccine is activating your immune system. People experience swelling, some people get a dead arm, the feeling at the site of injection. Some people experience headache, tiredness, fever, muscle pain, nausea, etc. Based off personal experience, when I got vaccinated, I developed a headache and I had a sore arm, and I felt tired for the rest of the day, but it went away in about a day or two. To help alleviate these symptoms, it's recommended that you take a painkiller, such as Tylenol, Motrin, anything that you can take, and apply a warm compress at the site of the injection just to help reduce the swelling and the inflammation, and drink fluids and get a lot of rest. There have been rare cases of reactions to the vaccine, as you may have heard. If you do feel like your symptoms are not getting any better, or there is a lot of swelling at the site of the injection, it's important that you call a doctor or you go to the emergency room so they can check you out. Because this is an unprecedented time, vaccination is strongly encouraged, and there are plenty of resources that can be utilized to help you stay healthy and protected. And it is better to get vaccinated than to go unvaccinated and get really sick. I have explained the development behind the COVID vaccinations and went over some questions that people generally have. And finally, I gave you information about how you can get vaccinated for yourself or a loved one. It's important to know the facts about vaccines. This is important to know because there's a lot of misinformation going on, and it's preventing people from getting the vaccine because people could potentially think that the vaccine could be dangerous. There's a lot of different opinions going out about the vaccines, and it's okay to ask the questions to a healthcare professional or to seek help for it. It's always better to get the right facts and get protected than go unprotected and potentially get sick. It is our job to help end the pandemic, and it's our job to keep each other healthy. Thank you.